If your shoulder hurts and you have been stretching it, you may actually be making it worse, because shoulder pain is not all the same. One type responds well to gentle movement, while another gets more irritated when you stretch the wrong area. In this video, I'm going to walk you through 3 simple shoulder tests you can do right now, sitting or standing. Each one gives us a specific clue about what your shoulder is struggling with most, and then I will show you the safest and most effective place to start. As you do these tests, pay attention to 2 things: where you feel the pain, and whether the arm feels painful, weak, or both. That difference matters more than most people realize. Welcome to Health Mile. If this is helpful, please hit the like button and subscribe to our channel. We bring you practical, science-backed health guides every single week. And let us know in the comments, which city are you watching this from today? Try the first test with me right now. Test number 1. The side lift pinch. Let your arm hang relaxed by your side. Now slowly lift it straight out to the side, palm facing down, nice and slow. At first it should feel fine, no pain. But right around the middle of the range you may feel a pinch, a sharp ache, sometimes a catch that makes you want to stop. If you feel that anywhere through this middle zone, you have just found your pinch zone. Now, here's the part that surprises most people. Keep lifting past that painful area, and the pain often disappears again. Pain, then no pain. That pattern is called the painful arc, and it tells us something very specific. There is a small gap between the arm bone and the bone on top of the shoulder. When the arm passes through that middle range, the structures inside that gap get squeezed. That is the pinch. You have probably felt it reaching for a plate in the cupboard, putting on a jacket, fastening a seatbelt, or lifting a bag. If that sounds familiar, the exercises for this type are coming up. Test number 2. The empty can. Hold your arm straight out in front of you, angled slightly to the side, about halfway between forward and sideways. Now turn your thumb down, like you are pouring out a can of water. That is the position. Now try to hold it there. If someone is nearby, ask them to gently push your wrist down while you resist. If you are alone, use your other hand to press down lightly on the wrist while you try to keep the arm up. If that causes pain in the top or front of your shoulder, or if the arm feels surprisingly weak, that is a positive empty can test. This points to one specific muscle in the rotator cuff, the supraspinatus. It does the heavy lifting every time you first raise your arm. When this muscle is irritated or weak, everyday things become difficult. Reaching a high shelf, putting dishes away, washing your hair, even pulling a shirt over your head. Most people think their whole shoulder is failing. It is not. It is usually this one muscle. Test number 3. The outward turn test. Bend your elbow to 90 degrees and keep it tucked against your side. Now try to rotate your forearm outward against a wall or door frame. If that causes pain in the outside or back of the shoulder, or feels clearly weaker than the other side, pay attention to that. This is a very common pattern in people who notice pain while steering, pulling a door open, reaching for a seatbelt, or turning the arm outward in daily life. If more than one test hurt, that is completely normal. Do not worry about getting a perfect label. Just ask yourself one question. Which test felt most like the pain I experience in real life? That is where you start. I will go through exercises for each test in order. Pay close attention when I reach your test. But honestly, watch all 3 sections. Even if only one test hurt, the other exercises help prevent the next problem before it starts. For the side lift pinch, here are your 3 exercises. Exercise 1. The pendulum swing. This is the gentlest starting point. No lifting, no effort, just gravity doing the work. Find a sturdy table or the back of a chair, something about waist height. Place the hand of your good arm on it and lean forward slightly. Let the sore arm hang straight down, completely relaxed, heavy like a rope hanging from the shoulder. Start with small, gentle swings forward and back. Not big, not fast, just an easy pendulum for about 30 seconds. Then switch to side, same thing, 30 seconds. Then small clockwise circles about the size of a dinner plate, 30 seconds. Then counterclockwise, 30 seconds. The whole thing takes about 2 minutes. When the arm hangs like this, the weight gently pulls the arm bone away from the bone on top, opening up the space where the pinch happens. Keep the swing small and lazy. If you go too big or too fast, the shoulder muscles kick in to control the movement, and that defeats the entire purpose. Exercise 2. The table slide. Sit at a table and place a small towel on the surface so it slides easily. Place the forearm of your sore side flat on the towel, palm down, elbow close to the body. Slowly slide the towel forward along the table, letting the arm glide out in front of you. Go until you feel a gentle stretch in the shoulder. The moment it starts to feel uncomfortable, stop there. Hold for a second, then slide back slowly. Do 8 to 10 repetitions. Breathe out as you slide forward. Breathe in as you come back. The table supports the full weight of the arm, so the irritated structures inside the shoulder do not have to work to hold the arm up. The most common mistake is pushing too far too fast. Think of it as asking the shoulder for permission, not forcing the door open. Exercise 3. The seated shoulder blade squeeze. Sit tall in a chair, feet flat on the floor, both arms relaxed by your sides. Gently pull your shoulder blades together toward the spine and slightly down. Imagine tucking them into your back pockets. Do not shrug up and do not arch your lower back. It is a small, controlled movement. Hold for 5 seconds, then release slowly. 8 to 10 repetitions. The effort should be between the shoulder blades in the middle of your back, not in the neck, not in the arms. When the shoulder blades sit and move well, the bone on top of the shoulder lifts slightly and the pinch zone opens up. Many people notice the side lift pinch test improving within 1 to 2 weeks of doing just this exercise alone. Do all 3, pendulum, table slide, shoulder blade squeeze, once or twice a day. Some mild soreness in the first 3 to 7 days is normal. Sharp pain during any movement is not normal. If it is sharp, reduce the range and try again the next day. For the empty can test, here are your 2 exercises. Exercise 1. The wall slide. Stand facing a wall about 1 step away. Place both forearms flat against the wall at roughly shoulder height, elbows bent. Slowly slide both arms up the wall, keeping the forearms touching the wall the entire time. Go as high as comfortable. Do not force it past where the shoulder starts to resist. Then slide back down. 8 to 10 repetitions. Breathe out on the way up, breathe in on the way down. Do not let your forearms peel off the wall. If they lift away, you have gone too high. Do not arch your lower back as the arms go up. Exercise 2. The isometric press into the wall. Stand sideways next to a wall with the sore shoulder facing it. Bend the elbow 90 degrees so the forearm points forward. Press the outside of the elbow gently into the wall as if trying to lift the arm out to the side, but the wall stops it from moving. Hold that press. Start with very light pressure, about 30% of maximum effort. Hold for 8 to 10 seconds, then release slowly. 5 repetitions total. After 3 to 5 days at 30%, if there is no increase in pain, move up to 50%. After another week, 60%. Never jump to maximum effort. Never push through sharp pain. With this muscle, patience beats intensity every single time. For the outward turn test, here are your 2 exercises. Exercise 1. Assisted external rotation with a stick. Grab a light stick, cane, dowel, or broom handle. Hold it with both hands in front of your body, both elbows bent to about 90 degrees and tucked against your sides. Use your good arm to gently push the stick across your body so the sore arm slowly rotates outward, away from your stomach. The elbow on the sore side stays pinned to your side the entire time. Only the forearm moves, turning outward at the shoulder. Go only as far as feels comfortable and do not force it. Return to the starting position, 8 to 10 repetitions. The good arm does most of the work here. The sore side is being guided through the motion, not forcing it. Do not let the elbow drift away from your side and do not twist your trunk to create extra range. Exercise 2. Isometric outward rotation into a wall. Stand with the sore side toward a wall. Bend the elbow 90 degrees and tuck it firmly against your side. Press the back of your wrist into the wall as if trying to rotate the forearm outward, but the wall stops it. Hold for 8 to 10 seconds. Start at 30% effort. 5 repetitions. Same progression as the other isometric, 30% for the first few days, then 50, then 60. Never go to maximum effort and never push through sharp pain. One important note before we wrap up. These exercises work well for common mechanical shoulder pain, but please see a doctor or physical therapist if your pain started after a fall or injury and has not improved in a few days, if the shoulder feels unstable like it might slip out, if you have night pain that regularly wakes you up, if your weakness is getting progressively worse, or if you have been doing the right exercises for 3 to 4 weeks and nothing has changed. These could point to a tear, a fracture, or something that needs imaging. Here is your plan for the next 7 days. If the side lift pinch test hurt most, do those 3 exercises once a day and do not add the other sections yet. If the empty can was your main problem, do the wall slide and the isometric press daily starting at 30%. If the outward turn was the one, do the assisted rotation first and then the isometric. If you failed 2 or all 3 tests, start with the one that hurt the most and add the next section after 1 week. Test your shoulder again after 7 days. If that movement feels even a little easier, that is real progress. If this video helped you, please hit the like button and subscribe to Health Mile. It helps this content reach other people who are struggling with the same pain and do not yet know where to start. See you in the next video.